Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 3-episode series with Dr. Callie Sawyer, the owner and sole provider at Sprout Family Chiropractic, where she specializes in pediatric, prenatal, and family chiropractic care. As one of only 2 chiropractors in the Fox Cities area with the full ICPA pediatric and prenatal certification, Dr. Callie is passionate about helping families grow up healthy so they can grow old happy. Dr. Callie's approach blends gentle chiropractic techniques, including the Webster Technique and oral ties care, with adjunct therapies like kinesiotaping, soft tissue work, dynamic stretching, and nutritional guidance. While she specializes in babies, toddlers, and pregnant mamas, she also loves helping active older siblings, teen athletes, and families looking to optimize their health. Outside the office, she is a proud wife of 13 years and a mom of 3 active and fun kids, ages 5, 8, and 10, and can usually be found coaching youth sports, wrangling the family's 2 Labradors, or cheering on Wisconsin teams with her husband. It's time to meet Dr. Callie. Let's get started with today's episode. Hello, welcome back to the Motherhood Alliance podcast. We are in episode 3 with Dr. Callie, and if you did not listen to our first 2 episodes, we talked a lot about kiddos in those episodes. Dr. Callie is a local chiropractor to the Appleton area. She is very heavily certified and specialized in kiddos and pregnancy. And so our first 2 episodes, we talked about those itty bitties and getting adjusted when they're little. But then our second episode was pretty fun and actually surprising coming from a pediatric chiropractor. We actually talked about nutrition, and I loved that episode because you were a mom yourself, and so you gave us all the tips and tricks that you're applying for your kids.
And specific too. I think that was really helpful for anybody.
Action steps for sure.
Mm-hmm. Love that. Well, in this episode, we're going to be diving into your other area of expertise. So there's the itty bitty kiddos, but then there's the mamas with the extra bump and belly. Mm-hmm. So very different type of clientele. Yeah. How does chiropractic look different for a woman who is pregnant?
Yeah. We're lucky in our area. We have a lot of Webster-Certified chiropractors. Webster Technique was a technique that started back in the 80s. It's just a series of steps that expands on chiropractic care. And so you can use the Webster Technique on anybody, but what they noticed back in the 80s was that when they were using that technique on pregnant women, Dr. Larry Webster was the chiropractor, they were seeing amazing results as far as deliveries that didn't require intervention and moms that felt great and kind of all those things. So that's kind of when it started back in the 80s. And now we have lots of chiropractors who are Webster certified, which is one class in the ICPA program. The ICPA is the group that certifies me to work with pregnant women and kids. And the Webster Technique is a weekend course where you can learn how to support a mom with a pregnant belly to help them balance their pelvis so that they can have the most optimal pregnancy and labor and delivery.
Because we're talking about the pelvis, we're talking about the ligaments, we're talking about all these
soft
different
tissue.
Changes inside of the pelvis.
Yeah. The Webster Technique, the way I explain it to my patients is it's 6 steps. We don't always do every step because you need to be, a certain far enough along in your pregnancy for us to do certain things. I can't really get to the round ligaments as well early on in pregnancy. There also isn't as much going on there as we can later on. So I always tell patients it's 6 steps, 3 of them with them laying face down, 3 of them laying face up. I'll always assess for all 6 steps, but I won't always do something towards those findings if there aren't any findings. So it's really kind of seamlessly integrates with our chiropractic care. And I do actually use the Webster Technique postpartum a lot as well, especially if moms are having a slower recovery. But it's a really effective but like gentle and safe way to adjust a mama who's got a baby in her belly, whether she's 8 weeks along or 38 weeks along.
What about within your actual space? Because a table, you said that 3 steps are facing down.
Right.
So are the tables different? How do you accommodate the bump?
Yeah. In chiropractic, providers do lots of different things, right? So our tables can accommodate what we do. And I have a Thule table where the pelvic area or the belly area drops down and away. And then I also have 2 really soft foam pillows. They're cut in a way where one side is like a little bit of a smaller cut in and the other side's a little bit bigger. So it's like an angled cut in the pillow. And I have 2 of those. One's a thicker pillow, one's a thinner pillow. And so you can imagine that those are very comfy to lay on. And so that opening is kind of where we put belly on top of the table that's already fallen away. And so moms are really comfortable. I often get feedback that like, I haven't been on my stomach for weeks. This feels amazing. And so it's definitely a relaxing position for moms to be in. And it definitely accommodates them. And then I have different settings on the table as well that I can kind of shift things up or move them around. I actually like to tell people I took care of a mom who was pregnant with triplets. She made it to 35 or 36 weeks,
Whoa.
I think. And we could accommodate her belly up until she was done seeing me at like, I think 35 weeks. So, there's definitely a lot to accommodate. And even if you're super early on and you just have a little pooch, we can make the table super comfy for you.
Nice.
I feel like I'm thinking back.
I know,
been a while
me too.
since I was pregnant, but I'm like thinking back
That was
and
one
I feel
thing.
like I would really want to just come take a nap in
I
your
know.
office because just to get that pressure
Yes.
off of your back and off of your hips and
Especially if like you're a belly sleeper like I am sometimes. I'm like, I remember that was one thing ingrained in my memory being like, I remember that. I just
So
wanted to be on my
comfortable.
belly so much. Yes.
Yeah, absolutely.
Yes.
And then those same pillows that I use for mom's belly to accommodate, I'll use those for baby. So
Oh,
once
yeah.
baby's here, then baby lays on those pillows and I can kind of flip them and rotate them and move them so that they accommodate whatever size baby is. Yeah, moms, it's actually really cute because moms will be like, oh my gosh, the baby was, when we first started here, the baby barely filled out the pillow and now their legs are dangling off, So like for parents, it's fun to see them kind of see like, oh, baby's getting bigger.
bittersweet.
Yes, exactly.
Right? Well, I think a lot of women are probably coming to you during pregnancy because they have actual pelvic pain or back pain. And our society nowadays, well, they just tell you kind of to expect that, but then just, suck it up and you still have to live your life and take care of your toddlers and do your job.
Right.
So, gosh, it's so hard.
Yeah.
It's so hard. And we just want to acknowledge that. So how can adjustments help with these like physical discomforts?
Yeah. I will say pain is often a motivator for pregnant women to come in. And I think kind of what we touched on too, like maybe nervousness about chiropractic if they've never had chiropractic care before, or just is it safe for baby? We're of course always looking out for baby and making sure that, whatever we're doing is safe. But everything that we do with mamas and with my exam is really looking for any reason not to adjust mom. So if they check all the boxes and everything looks good, it is super safe for them to be adjusted through chiropractic and with that Webster technique. But yeah, I will say a lot of times, pain is what brings mamas in. And there's lots of factors that can affect how their bodies move and function. Maybe they've had previous injury, an accident or a fall that's affected maybe how they function and move through life. But we have these hormones that go through our body that make all the ligaments that support the spine, especially the pelvis, make them maybe a little more lax. And so we kind of lose some of that stability. And, I don't do a ton. I definitely have utilized and will recommend, SI belts or belly bands or different things depending on the patient. But it's really not that common that we need that extra support because once these mamas can have their pelvis balanced through chiropractic care and then sometimes some pelvic floor PT or, other sort of therapies that support what we're doing, massage is another one. Once we balance things out, their pain levels often will be more reasonable. We talk a lot about function because it is common for pregnant women to be in pain. It's not normal. We don't see every mama have pain during pregnancy. I have one that's due next week and she's like, the last month she's come in and she's like, I feel pretty good
That's
actually,
amazing.
which is awesome. So definitely the supporting them through the Webster technique, and giving them that support can help with pain and discomfort. And then my job is just to keep them feeling as good as they can throughout their pregnancy.
Do you help to educate them as well into things that they can do at home to help maintain comfort? Like I think about sleeping, and there's some people that when they're sleeping and they're pregnant, they have like 48 pillows, and the husband might as well just go sleep on the couch.
That was me.
So like how can women maintain this comfort in their homes?
Yeah. And if you're meaning like we give them the chiropractic adjustment, they feel better, how do they maintain it? I mean, it's kind of what we've been talking about in our previous episodes too, which is like maintain your stress, manage your stressors. And one of those can be sleeping in position. So if you're a side sleeper, make sure you've got a pillow between the knees. If you're bringing the arm up underneath your head, make sure that your pillow is supportive, but not overly supportive. So, there's certainly like mechanical things that we can talk about with sleep and other things that you're doing throughout your day. I do find that with people's jobs often being at a computer, or if somebody's on their feet a lot, we really talk a lot about like, what does your day-to-day look like? Like you mentioned, if you've got littles at home and you're like, oh, my first pregnancy was a lot easier because I wasn't chasing a toddler. Now I'm chasing a toddler. I don't have the opportunity to just like lay down and rest when I'm feeling tired. So, it is definitely talking about like all those stressors throughout the day and how can we mitigate them? How can we manage them on top of what we're doing with our chiropractic adjustment. So lots of patient education there for sure.
I love that. I think another question that I need your help understanding is because a lot of people think that chiropractors can help flip babies. Is that true or false?
That is false. Okay. What I say, so let me, with the caveat, chiropractors back in the 80s got really popular with Dr. Larry Webster. He was the one that noticed that babies were going head down when they would come to him in a breech position. And so I'm always very careful to say, I do not flip a baby. That's what OBs do. That would be practicing obstetrics. I don't do that. So we don't flip babies. What we do is we balance the pelvis, specifically the round ligaments, the sacrotuberous ligaments, the pubic bone, the SI joints, all those soft tissues and ligaments that support the pelvis. Balancing those out allow the body to move and function the way that it's supposed to. And that will provide normal mechanics, hopefully normal movement, and therefore improve symptoms. A little bit more
space, right?
Exactly. Yeah. Providing the proper amount of space. Yeah. So we don't flip babies, but I will say that I have seen enough, anecdotally, I can tell you that I have had moms come to me where baby is not head down. After 1 visit, 3 visits, 5 visits, baby is now comfortably head down. So it is about creating space. It's about creating movement and function to allow baby to do what it's naturally meant to do. Yeah. Baby knows what to do. If there's something structural keeping it from getting there, that's our role. Yeah. And there are times where baby does not go head down after regular chiropractic care. And a lot of times we find baby had a short cord or the cord was wrapped around their neck. And you go, well, yeah, innate intelligence is saying, baby's not going head down. That's not going to keep baby safe.
Right.
Baby is safest in this position. And if baby's born via C-section, then that's what baby needed in order to get here safely. Yeah. So, we find that that's usually the case, that there's something limiting baby from going head down.
How can chiropractic adjustments later on in pregnancy help prep a woman for labor? Or can it help make labor easier? And if so, how?
Yeah. So one of the things that I'll talk about a lot is progression with patients. So if I sort of prep them ahead of time, like, just so you know, if baby decides, you're at 40 weeks or you're at 41 weeks and baby still hasn't engaged and gotten head down and touched the cervix where it should, the head needs to hit cervix just right in order for the birth, the labor process to kind of develop. And so if the pelvis isn't moving or is stuck or is restricted, baby may not be able to get to that cervix to kind of like hit that
go button.
Yeah, exactly.
There you go. Now you got a new word.
Yes, that's right. The go button. I like that. To kind of get things moving. And so I'll say, if it's been a bit since you've seen me and you're feeling like things should be moving along, but they're not. Sometimes chiropractic care, again, we're not going to put you into labor, but we can balance the pelvis and potentially move things along. Hit that go button, if you will. Yeah.
I like it. So let's say that a woman is coming to you, she's like 35 weeks, she's 38 weeks, somewhere in there, and she's like, okay, it could happen tomorrow, it could happen in 3 weeks, I don't really know. How do you navigate scheduling appointments in that time frame, as well as like trying to schedule appointment for when baby is born for her first postpartum, as well as baby's first appointment? Because I would think, ideally, let's say that you're going to have your baby at 8 p.m. It'd be so great to see your chiropractor at 8 a.m. so that you are all aligned and ready to go for that birth process. But you can't really figure that out. So how do you navigate scheduling at the end of a pregnancy?
Yeah, that's a great question. I've been stood up a lot, meaning we put appointments out there, and then, I'm like, oh, they're pretty far along in their pregnancy and they're 5 minutes late. I bet, but actually my patients are great at letting me know. I always say, just put me on your list of people to let know if you go into labor, because then we can cancel your appointment. I never charge a mom who's missed because they've gone into labor, because it does happen. Yeah. But when it gets towards the end, a lot of times, especially at the end, a lot of women are like maybe taking a week before baby's here to like not work. And so we have some flexibility. So I usually say, if you have flexibility, let's just wait and see what happens. You can get on the schedule if you haven't had baby by, this and this date. So that's usually kind of how we navigate the end of it. And usually like or husbands are really good at letting me know that that baby is here and they won't be making their appointment. But a conversation that I will often have towards the end of pregnancy, because moms will say, okay, I love getting care during pregnancy. I've felt how good I feel. How do I get myself scheduled after baby's here, or my baby? Why would we get baby, and when can we do that? What I usually say is you're probably going to be in one of two camps. You're either going to be feeling really good after pregnancy or after delivery, and baby's doing really well, like we mentioned earlier, really good eating, sleeping, pooping. Everybody's doing good. In that case, come see me when you're ready to like walk through Target. Come see me when you're like up and about, you're feeling good, 2 weeks-ish, somewhere in that ballpark. And so they'll usually reach out and say, baby's here, because I love getting pictures of newborn babies, and I get to learn their names if they haven't figured all that out. So that's like one camp. Sometimes we have another camp of moms who baby comes and they have a hard time feeding, or they are so fussy and they don't sleep. Or mom, because they're breastfeeding, has a ton of upper back and neck pain from holding baby and all of that. So those mamas, I say, get in as soon as possible, because we are able to modify how we treat. Yeah. And so even if a mama comes in with a C-section, we can still absolutely adjust them. We're just going to have to modify how we do it, what techniques we use, and make sure that it's super gentle and super safe and effective for them. So we are able to adjust anybody at any stage. We just have to maybe modify a little bit.
Yeah. I love that.
Yeah.
One thing you just mentioned that triggers another question is you said if baby is like, if feeding isn't going great.
Yeah.
So what role would you play in kind of analyzing a feeding role versus like an IBCLC, or why should they come and see you if they're having trouble feeding? Yeah,
great question. So let's talk like IBCLC, like what the function of an IBCLC lactation consultant who's board trained, but they're looking at function, oral function, and they're looking at how the actual latch looks. They're assessing that and seeing, what they can do to help that. Whereas my role is more looking at the structure of baby and saying, okay, well, they prefer to look to the right. They're not looking to the left. My guess is that they're having a hard time nursing on mom's right side. Oh yeah, it is my right side, or whatever. And it's very obvious because they're kind of stuck in that position. Again, maybe they were in utero stuck in that position. Maybe there was some birth trauma where baby had to be helped out. And then there was some sprain strain on the soft tissue of the neck. And so now they're kind of not necessarily torticollis, but definitely in a position where they're stuck. And so it's really just kind of assessing, is this what's preventing them from having good movement and therefore latching well? I always kind of use the example, and this is something kind of fun. You guys can do this with me. Anybody who's listening can do this. If you turn your head to a side, it doesn't matter, and then try to swallow, does that feel normal? No, I mean, it just feels uncomfortable. It's not like you can't do it. It just doesn't feel right. So imagine you're a baby who's stuck in one spot, trying to then swallow, and they're having a hard time doing it. So that's one way that we can maybe help with function. The other thing is that the cranial bones have nerves that come out of them and go to the mouth, the cheek, the tongue. So sometimes the birth process can create a lot of swelling in those cranial nerves, the facial nerve, different nerves that, again, go to the really important parts for feeding. And so chiropractic care, and I do cranial work with my babies, can help with that function and help to relieve some of that swelling and tension that could be affecting how the brain and how those cranial nerves are communicating with the mouth, which would affect feeding.
That was a great answer to a really good question.
Yeah.
I love it.
Yeah.
Well, and I feel like it circles back to our first episode where we were talking about how awesome it is that chiropractors can almost be like your go-to wellness provider, if that makes sense.
Yeah.
Like there's always a time and place for medical providers.
Of course.
But having a wellness provider that has more of that like natural and holistic mindset can be so helpful. And just knowing that your confidence in understanding your scope of practice and your role and how you can help these women, but also understanding like, okay, but I have all these other providers in my back pocket that I can like link arms with and help you figure it out.
Yeah.
Right? Like I'm not just going to ditch you and say, good luck.
Totally.
I can't do that out of my scope.
Yep. Yeah.
It's like actually helping people find the help that they need, which is why we started the Motherhood Alliance originally. It's because we've all three of us sitting here, we're all moms and we've all been through these little phases and through pregnancy, and it's so confusing and you've no time for research.
Right.
And so just having someone like you to go to is so amazing.
That's sweet. And being a part of the Motherhood Alliance has been a game changer in that way too. If I'm looking for, a prenatal massage therapist or, whoever might be in your directory, it's so nice to be able to be like, there are going to be lots of providers that you're going to potentially need during this time.
Yeah.
Go to the Motherhood Alliance directory, see what you can find in there. There might be people in there you didn't even think that you might need, and that can maybe spark, help you on your health and wellness journey during this pregnancy, during this postpartum time, and all of that. So that's sweet. But I think you guys have been a huge part of that as well.
Cool.
Yeah, awesome. I know that we kind of talked about your ICPA certification. And is there like a way that you can find, go online and find different ICPA providers?
Yeah. The ICPA is great. They are a nation. Actually, they're worldwide. They have providers on different continents as well. But on their website, ICPA, the number 4 kids.org, ICPA4kids.org. You can go on there and put in your zip code, and it will give you a list of providers who are in the ICPA network that are close to that zip code. You can filter them to be either DCs, which would be a doctor of chiropractic. You can filter them to have a Webster Technique certification, which would be, again, that one weekend course that they would take to learn the Webster Technique. You can also filter for a CACCP certification. That's what I have. That was the Webster weekend plus 15 other weekends to learn about how to care for pregnant women, babies, and families. And then there's even higher certifications as well. So you can search for those, see who you have in your area. We have some people that have to drive a little bit to see an ICPA provider. The Fox Valley is not one of those places. We have tons of them around here, which is great. But that's a great resource. So ICPA4kids.org, and then you can put your zip code in and find somebody very easily.
Yeah, I feel like that's a great resource just because if you're looking for somebody who can really support you in pregnancy and postpartum and your babies and your kids, having somebody who really specializes in that, not just sees a kid,
right? Right, because it is in every chiropractor's scope to be able to see kids. But you're right, to have that confidence maybe, and to be able to really, somebody who sees kids all the time, has that experience, can definitely bring some comfort to a mom who's maybe a little nervous about bringing a kiddo in.
I would say kids and pregnancy. Because pregnancy is a whole different season of ballgame. So.
Absolutely.
Well, thank you so much for sharing your knowledge in all these areas. I would love to just ask one final question to finish out our series, and that would be, what is the future of Sprout Family Chiropractic hold? Or maybe even just you as a busy mom and
we
coach.
dropped
and
it
all
on
the
her. We didn't
things.
prep her for this one.
You didn't prep me. No, that's okay. I am really happy where I'm at right now. I love the fact that I have a balance of, and this was kind of my, I guess maybe intention going into chiropractic, knowing that I could sort of set my own schedule, be as busy as I want. I was really, grateful to learn from some chiropractors when I first started my practice on how to run a business and all of that. But now I'm in my niche. I get to take care of people I love, have my, be able to coach my kids and be on the, PTA board and, volunteer at stuff at school. And so there's definitely a balance that I'm really enjoying right now. Not to say that maybe when I have a little more time, I might expand some things or do some more things, but maybe even bring a young chiropractor under my wing to say, hey, this is how you can really take care of families and enjoy what you do and have an impact on your community. But for right now, I'm happy. I'm good.
Nice.
Yeah.
Living the work-life balance.
That's right.
That's so hard to achieve.
It really is. It's taken, 14 years to get here. So, it takes time and effort and a lot of grind, but, then you get to a spot where you get to enjoy it all.
Nice.
Yeah. Thank you so much for joining us for all 3 of these episodes. If you guys would like to check out Callie, you can find her at, what's her website?
Yep. SproutFamilyChiro.com.
Great. Thanks, Callie.
Thank you. Thanks, ladies.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.